Hello, hello. Welcome back to my channel and my new glasses that I'll have to be probably wearing for the rest of my life, which I can see, but I don't feel comfortable seeing because of my eyes. And that video is coming later. So today is a nursing video. Um, quickly, I have to say this video. There are some instructors in nursing that do not want you to succeed in the program. I know you think, oh, they're making you a better nurse. They wanna make sure that you know your stuff, and you can know you know, your nursing information backwards, forwards, upside down, standing on your head, however you know your information, you can know it. But there will always be and there was this lady on TikTok that she did a video where she was talking like she was talking to somebody in the back seat, and she was screaming and yelling at the instructor, saying, "Well, if you didn't want to be a good instructor, if you didn't want to teach, if you didn't want to train me, if you didn't want to take your patients and have time, then you should have been an instructor." And then she turns around and she's like, "Did who said that?" Like, she does one of those. And there are some instructors like that. They don't want to see you in the same position they're in. They're not doing it for your benefit. They're doing it to hurt you, hopefully discourage you enough. This is what the enemy does: steal, kill, and destroy. They're hoping that they discourage you enough. They'll tell you you're slow, tell you you're not, um, don't seem like you're catching on. And 90% of nursing is repetitive. So you might deal with a heart transplant today, but it'll be like you might see another heart patient. It's the same stuff. Nothing new has happened since Florence Nightingale. Nothing. Nursing is still the same. But there are people out there that don't want to see you succeed. They don't. I mean, it's life. If people wanted everyone to be millionaires, wouldn't we all be millionaires? There's secrets to wealth. But if people don't want you to be where they are, they will keep you. It's a stumbling block. They will keep you from being where they are. And they might not be nowhere, but they'll keep you out of the profession. And they say they need nurses. They don't. They're not looking really for even quality nurses. They don't want you in the profession. And if they can block you, however they block you, because they use their position, they use their power to keep you out. And you can tell somebody your concerns. You can say this or that. They're never going to side with the student. They're always going to side with the instructor. Unless the instructor come boldly up to you and slap you in the face, that would probably be the only time that they would really consider that, yeah, this instructor has a problem. I don't care who you tell. And it seems like as African American students, we need our own college with African American instructors. Luckily, I grew up down south where I know what good African American instructors look like. Not in nursing, but just good African American instructors that want to see you succeed. So when somebody else come along and they don't want to see you succeed, that's your problem, not mine. But when it comes to nursing, if you have an instructor and they don't want to see you um, succeed in the program, that you can be the smartest thing out there, and if they don't like you, or they they won't say they don't like you, they fake fun. And I live in the state where they say everybody's nice, and knowing that's a lie. Everybody ain't nice. So back to what happened to me when I was in nursing school doing my LPN program. I had an instructor. There were 10 of us. There were 6 Caucasian students and 4 students of color. one African male, one African woman, myself, and an Asian student. And we had a shortened clinical week. The instructor came back and she graded all of the students of colors paper and one of the students that was Caucasian that struggled with some mental health issues. And they ended up dropping out because they got deployed in the military. And she came back and she said, "Oh, I didn't have time to grade everybody's paper, but you had time to write enough red ink on all of the students of color's paper, but you didn't grade the white people's paper or the white students' paper. You didn't grade their paper. You graded the people of color." And you think, oh, well, maybe she didn't have time. Oh, she had time because most of what we do in nursing school, everything is graded. And so, true to form of when the enemy is trying to stop you, they don't just do it one time. It's almost if they can get away with it one time. And I went to the school, I reported it because I knew something about this. This wasn't right. You mean to tell me you had 10 students and you only graded the students of colors paper? Nah, something wrong with that. But true to form, she did it again the next semester. And student of color went to the dean and to the school board, and she got removed from teaching clinical because it wasn't that we didn't know anything. It was that you decided personally that you were going to make sure that the students of color did not pass. Just like we take tests to get into the program, I feel like instructors should take tests to see if they're competent to teach. Just because you got the degree don't mean that you're competent to teach everybody or want to teach everybody. Let's put it like that. Want to teach. And so other than African American students or students of color having their own schools with students or instructors that look like them, just know that there will be people that will try and keep you from succeeding. It's the truth, it's the facts. No matter how you dress it up, you can be like, well, they were dumb and they weren't getting A's and B's and whatever it is. The enemy tries many things. And it's shameful that if you, as an nursing instructor, would do whatever it takes to keep some people out of a profession in which we're not caring for ourselves, we caring for other people. One day we might even, as nurses, be caring for you, and you want to keep somebody. You work that hard to keep somebody from succeeding. First of all, the price of college is not cheap. One class, two classes, three classes, how many ever nursing classes you got to take? It's not cheap. And there should be standards, just like there's standards in care, there should be standards for instructors. Because for you to fail students is a reflection of you, not a reflection of the student. But the student knew this. This student, said, I just felt, like they were up to something. Trust me, they were. They won't change until guess who stops them? And the funny thing, when that person stops them, the good Lord stops them, they're going to wonder why. So you have a blessed day. If you're an African American student, I pray for you. Bye bye.